Do you know that the deadliest hepatitis, which is hepatitis B virus, HBV, has contributed to an estimate of 820,000 deaths every year in the world and affects approximately 296 million people, including over 6 million children under the age of 5. In Nigeria, the highest hepatitis B virus prevalence in rural settings is 10.7%. The Northwest region has the highest prevalence of 12.1% among Nigeria's 6 geopolitical zones and regions. Also, 25% of chronic hepatitis B infection progress to liver cancer, according to subgroup analysis. Hepatitis is an inflammation of the liver that is caused by a variety of infectious viruses and non-infectious agents, leading to a range of health problems, some of which can be fatal. It is a viral infection that lives inside a living cell in the human body.
How often do you check your health status? How often do you check your hepatitis status? Hepatitis is the inflammation of the liver. What could be the causes and how can it be prevented? Let's find out.
Dr. Agantem Ekuma, a medical microbiologist, University of Uyo Teaching Hospital, UUTH, disclosed that hepatitis virus comes in 5 main strains, which includes types A, B, C, D, and E. While they all cause liver disease, they differ in important ways, including mode of transmissions, severity of the illness, geographical distribution, and prevention methods.
Yes, hepatitis is an infection of the liver, and most of the common causes are caused by viruses. So basically, hepatitis is infection of the liver and the symptoms that are associated with it. The viruses are the common causes, so the types of hepatitis are named according to the viruses. So we have hepatitis A, hepatitis B, hepatitis C, D, and E. I think those are the common ones that cause hepatitis virus. So HIV is a virus also, and hepatitis also is a virus. So hepatitis, the ones I've mentioned, are viruses. So unlike HIV that attacks the cells of your immune system, hepatitis attacks mainly the cells of your liver. So it causes liver damage and eventually liver failure. Yes, because they cause chronic infection, prolonged infection.
The virus may be caused by viral infection, alcohol consumption, several health conditions, or even some medications, and can be transmitted through body fluids such as blood, vaginal secretions, or semen.
Like I said, they are viruses. So the viruses are infectious particles, and so they can be transmitted from one person to the other. So like I said earlier, hepatitis A and E are mainly transmitted by food, but they cause mild disease, so we don't consider them as a very serious problem. But the ones that are of much public health concern are hepatitis B and C, and those ones are transmitted by body fluids. So it can be transmitted by sexual transmission, it can be transmitted by blood transfusion if the blood is not properly screened. It can also be transmitted, through unsafe injection, sharing needles and things like that.
The 5 main viral classifications of hepatitis are hepatitis A, B, C, D, and E, and a different virus is responsible for each type of viral hepatitis.
The common ones and the ones that cause chronic infections are hepatitis B and C. So hepatitis D can occur together with hepatitis B, but it's not so common around here. Hepatitis E too is not very common, but it's a milder form, just like hepatitis A. So those ones are associated with food. They are transmitted by food, and then they tend to have a shorter duration compared to B and C, which can last a long time and cause severe liver diseases. Yes, so hepatitis A causes acute hepatitis, which is usually self-limiting. So it presents with body pains, feeling of illness, and then there may or may not be dark colored urine and all that. So, but usually with or without treatment, the body tends to contain the virus, and most cases, more than 99%, will resolve without progressing. But there is a little percentage that may have a fulminant infection. That is, the infection just goes beyond control and can lead to death, but it's extremely rare. So for most cases of hepatitis A, usually it occurs in outbreaks among children, you know. So someone infected, passing it in his stool, does not follow proper hygiene, can spread it to other members of the household or other persons he interacts with. So that is hepatitis A. It usually occurs in outbreaks, but we are not seeing that as a major condition or cause of mortality in this environment.
Hepatitis B virus is the most common form of parenterally transmitted viral hepatitis and an important cause of acute and chronic infection of the liver. The incubation period of hepatitis B is variable with a range of 1 to 6 months. Acute hepatitis B is frequently enecteric and asymptomatic, although a severe illness with jaundice can occur, and occasionally acute liver failure may develop.
Okay, so I've already mentioned that they are caused by viruses and they are transmitted by sexual intercourse, blood transfusion, and the sharing of needles, anything that involves body fluid. So if contaminated body fluid comes in contact with your own body fluid, which can happen in any of these settings that I've just mentioned: sexual intercourse, transfusion, sharing of needles, and other things that will expose your blood to other things. So when this occurs, the virus affects your liver, and the symptoms that I guess you're asking about the symptoms. So the common symptom that we say of hepatitis is yellowness of the eyes, and sometimes abdominal pain, sometimes fever, and all that. But for hepatitis B and C, sometimes those symptoms may not appear at the initial stage, and it will just progress and become a chronic infection. So those symptoms may or may not be present, but in the long term, after the virus has stayed in one's body, particularly hepatitis B, if it has stayed in one's body for several years, it now causes chronic liver damage. It will be damaging the liver gradually and progressively until it gets to a point where the liver is unable to function, and that leads to other symptoms which eventually can lead to death if not properly treated.
Treatment and prevention of hepatitis virus varies based on the type and underlying cause.
Hepatitis C is more easily curable. There are now very highly effective drugs available, although they are quite costly. So with early treatment, early diagnosis and treatment, a full cure can be achieved. There are also treatments for hepatitis B, but not so effective as the ones for hepatitis C. They are antiviral drugs. Yes, and they can be prescribed by a qualified physician. Well, I think all efforts should be geared towards prevention. So if you are living a safe lifestyle, you are carrying out safe sexual practices, you are only getting blood transfusion from reputable health institutions where you are sure that the blood is properly screened, then I would say the risk of acquiring this hepatitis B and C is very low, and so one may not really need to go for testing on such a regular basis. For hepatitis B, there is a vaccine that is effective, so if you've not been vaccinated, you need to get vaccinated. If you're not sure of your status, you can be tested to know whether you have antibodies against that infection, because that's what the vaccine does, is that it makes your body to develop antibodies, so that if you come in contact with the virus, it will not be able to, and an infection will not be established. But that's for hepatitis B. So for hepatitis C, we don't have such a vaccine. There's no vaccine available yet. So prevention still remains key for control of hepatitis C. So that's for vaccination. Then for safe sex, of course, limit your sexual partners, and if you cannot do that, then barrier method, use of condom and all that can provide some degree of protection from that route. Then again, blood transfusion. Make sure that any blood that is being transfused is gotten from a reliable source. Then avoid sharing of needles. So all needles for injection of whatever should be single use, should not be shared under any circumstances. So if you do this, I believe that you are protected and covered from these infections. Your initial vaccination, 3 doses, taken over the course of 3 months. So after that, it's recommended that every 10 years one should get a booster. But we see people even beyond 10 years still having high levels of antibodies. So it depends. I strongly believe that the vaccine gives protection for more than 10-20 years.
To prevent hepatitis, Dr. Ekuma has advised regular medical checkup, avoid multiple sexual partners, get vaccinated. Remember, hepatitis can lead to chronic diseases and death. My name is Esther Otoyo. Enjoy the rest of our program on Spectrum TV.